Okay, well, greetings. Welcome, everybody. This is Biotensegrity Party number 19, Fascial Stretch Therapy with Anne and Chris Frederick. And I'm your host, Susan Lowell de Solorzano, coming to you from Washington, D.C. I'm joined by co-host Graham Scarr over in Nottingham. Hey, Graham.
Hello, Susan.
And Chris Marita Clancy, who's in Deep Cove outside of Vancouver. Hey, Chris.
Hi, Susan.
And we've got also with us associate producer Rachel Tudor, who's in Tumwater outside of Olympia. Hey, Rachel. She'll be helping us with questions and such as we go. Our technical director, Mariana Barreto, is off this week, so pray for us. Production assistant Lisa Babiuk is here from St. Albert. Hey, Lisa.
Hello, Susan. Hi, everyone.
And all the way from Tempe, Arizona, Anne and Chris Frederick.
Hey,
morning, guys.
Hello, everybody.
Morning for you, right?
Yes. 10 o'clock.
Yeah. Would you help us out by doing the opening toast?
So all here in attendance, and even to those who are not here in attendance, we salute and say cheers to everyone to kick off this tea party.
Hear, hear.
Hear, hear.
Cheers.
Cheers.
Wonderful, wonderful. Well, so 19 of these we've done, which is amazing to me. And we could not have done it without our wonderful sponsors. So we're going to take a minute before we jump into the main material to hear from Graham.
Thanks, Susan. Our Biotensegrity Tea Party is a volunteer production of the Stephen M. Levin Biotensegrity Archive and made possible in part through the generous support of our wonderful sponsors. Starting with Handspring Publishing in Edinburgh, Scotland, producers of highly accessible, easily applied research-based material for movement and manual therapy professionals. The amazing team at Handspring see publishing as an art as well as a science. And for them, it's a human and intellectual enterprise as well as a business. They offer a generous discount coupon to those on the Biotensegrity archive mailing list and to all our Zoom participants. So if you're not a member and signed up for the Biotensegrity archive mailing list, do so as soon as possible. We're also generously supported by Chris Clancy's educational organisation, Embodied Biotensegrity in Vancouver, British Columbia. And for those of you looking to learn more about biotensegrity, Chris's programs are an excellent resource. The membership group, Biotensegrity Trailblazers, meets twice a month. And Chris and Rachel will also be offering a free intro webinar on biotensegrity sometime in August. The Biotensegrity Tea Party is also sponsored by Artifact Pro of Madrid, Spain, where you can find beautiful and wonderfully constructed tensegrity models, including those of the spine and pelvis. Artifact Pro also offers a generous discount coupon to our viewers on the Biotensegrity archive mailing list and to all our Zoom participants, and we are grateful for that. And finally, we are very kindly supported by the British Fascia Symposium in the UK, which not only organises their biannual event, but also several other exciting programs. So check them out as well. Back to you, Susan.
All right, thanks, Graham. So whoever you are, wherever you are, please use the chat. We always like to hear about, especially if you're new, how you found out about us and what your interest in biotensegrity is and where you're coming from. It's always great to hear. You can put your questions in the chat as well. And Rachel's going to be monitoring that as we go. So time to jump in. Anne and Chris Frederick are doing something right because they have trained hundreds at least of people who have then gone on and helped thousands upon thousands more. And they've done a lot themselves with their manual assisted tissue mobility technique that they call fascial stretch therapy. And I am so intrigued by what they do that I am delighted to have them join us today. So welcome. Welcome, Anne. Welcome, Chris.
Thank you, Susan.
Thank you, Susan. Hello, everyone. And we're so excited to be here. And I have a little bit, we're going to go back and forth with my PowerPoint, but it's not a PowerPoint presentation. It's just to reiterate things and to drive some points home and have some visuals so you can appreciate where we're coming from. So I'm going to just switch to the screen share now so Anne can talk, but I'd like you to see some of these images. It kind of speaks, you know how a picture says more than 1,000 words. So I'm going to share the screen. I'll go to my PowerPoint. I'll go to screen. Sorry about that. Let's see, got to get this moving out of my way. Let's start the show here. I got to move this and there we go, slideshow.
So while Chris is doing that, can
There we
we
go.
have our audience please turn off your video for now? For the first part of the tea party, we like to have just our guests on and our hosts. That way, those people on YouTube will have a better viewing experience. Okay, thank you.
Great. Can
Yes.
you see
Then,
that?
I'll also say that later on, if you do have a question, we'll let you ask, but we will unmute you for that. So don't be concerned that your video and audio are turned off at the moment. Thanks. Over to you, Chris and Anne.
Great. Can you see the screen, Anne Frederick?
Are you asking me if I can
Yep.
see?
You can see it.
Looks-
Anne's going to start
oh
talking.
my gosh, a bunch of cut-ups.
Anne's going
Yeah.
to start talking. I'm going to turn up the light a little bit because we're getting dark here.
Ah.
Go ahead, Anne.
So for some reason, Chris decided to drag out my old dance pictures to start this, which I think is entertaining and embarrassing at the same time. The technique that we've created came from the love of movement. And I started dancing when I was little tiny. I think I was maybe 4 in that first picture, and danced for a very long time, danced professionally ballet. And it progressed into the picture on the bottom, which is actually the Olympics of 1996 with the Olympic men's wrestling team, where I was the first flexibility specialist at the Olympics. So I was creating something that was apparently brand new, but fun to play with these amazing athletes and create something that has turned into, as Susan said, we've actually trained about 5,000 people and over 1 million have experienced it. So it's exponentially grown through the last 25 years.
That's great. Wonderful. Now, I know everybody who does fascial stretch therapy, everybody who gets trained in it is biotensegrity aware, that it's in your books, it's in your curriculum for your students. So at some point, you'll tell us a little about your background specifically with biotensegrity.
Indeed, how it integrates. And that's where it's a perfect time for Chris to step in, because he brings a very unique background that took to the concept of it very readily and has a very informative way to put it into the technique that we do. So Chris, you're on.
So I'm going to say I'm a clown. I'll just put it out there. This is, we're talking about a serious topic, but I just want you to know a little bit about, this kind of says a lot. Besides being a clown, it informs, I think, a little bit of my background as a dancer. I come back, really, I like to relate this to biotensegrity. And I think dancers, of course, I'm biased, but as a contemporary ballet dancer, the way we train our bodies is extreme. We really go through the limits of our anatomical fascial net. We explore it and we maximally contract it and we maximally expand and extend and stretch it in a way that other athletes don't. But they're all to be respected. But dancers have a certain way of exploring their bodies in a way that a lot of athletes do not. I'll just leave it like that. So there's something there about the actual experience is what I want to bring home of your own body in bringing our philosophies forward. The next thing is I have a background. I'll get out of this because this is a silly photograph. So let's talk to you. Stop sharing that. I have a background in architecture. I went to a engineering high school. It's called Brooklyn Tech High School. And I was able to be very fortunate getting exposed to Buckminster Fuller and tensegrity in high school. And I was swept away right away. I mean, he just engaged, you know, he was my spiritual leader in architecture. I followed his works. I read everything I could about it. And I was able to actually design my own house and build it in high school. It was a very special high school. So I got exposed very early. And after that, I actually went to work for an architect. I did not go to college. I started going to work for an architect, and then they paid my tuition to attend Pratt Institute of Design and Architecture School. So there's some background there with tensegrity is basically the point I wanted to make. Let's see. Let's get out of screen.
And with functional structure in, at least with inert materials, which is also interesting. Were you dancing in high school as well, or was that later?
Well, actually, in high school, I did gymnastics. I didn't want to be on the team. I was too busy, but I worked out with the team. And that's where I developed my interest in exploring the limits of my anatomy, literally, of what can I do. And gymnastics, if you know anything about it, it's a very extreme sport. And you do the same thing. You explore the limits of your strength and the limits of your flexibility. So when I graduated from high school, I couldn't do gymnastics anymore. I went into dance. Quite late in the professional world, but I actually became a professional dancer because I was driven and I was able to train. I was very fortunate in New York City to find the right people to train me.
That's great. That's great. Now, I know you've got stuff. I want people to see what you do when you do fascial stretch therapy. And I think you've maybe got some clips of that, but you guys know what you want to show us and tell us. So,
okay,
in any order you like.
Let's see if I have something along those lines. Well, I was going to have everybody stretch now, but we can save that for later.
Yeah, that's right. Whatever you like.
We can save it for later. Do you want to do that now? Whoops.
Hey, yeah, always good to get up and stretch.
Yeah, let's stretch before we talk about stretching. How's that? So everybody, I have a little slide. It's a 1 minute, that's all, 60 seconds, but it actually is a way to undo prolonged sitting, which we all have been doing at one time or another. So I'm going to show you before we do this, I'm going to narrate. So basically you're going to stand if you're not already. So everyone stand and just watch for a second. You're going to put your hands like this on your upper glute area, your fingers pointing down. It brings your elbows backward. And then we're going to inhale. And then as we exhale, we're going to just gently let the hips come forward. And if you want to do a little heel raise and bring your heels a little bit off the ground, that would be even better. And if you look at that position, I'll bring it forward a little bit. If you look at that position, what it does is it obviously opens up the front of the body, or in anatomy trains, they call it the front net, the superficial and deep front net. But if you do a heel raise, it pumps the venous fluid out of your legs to prevent pooling in the legs. And it goes all the way up to the brain. So it keeps you more alert. Should you be falling asleep during your projects or finding yourself getting tired. It also helps, if you look at the lumbar spine, it helps to push your discs. All of us are getting bulges at one time or another. This reduces your bulge from prolonged sitting and decompresses your body. And of course, it opens up the anterior chain of your body all the way up. It opens up that tendency for forward shoulder and forward head as well. So let's bring it back to the beginning and we'll just do it. Let's see here. And we'll go back to the beginning and here we go. Let's play. So take a deep breath, everyone. Hands on the back. Make sure your feet are underneath your hips. Take a deep breath. And then slowly on the exhale, let your hips come forward and look up a little bit without hyperextending your neck. And let's do that again. We may go a little further if it's okay, but if it hurts, don't do it. So you inhale, you exhale, and you let the hips come forward, just a little forward, pushing those discs even more forward to prevent those bulges. Maybe doing a little heel raise. Third repetition, deep breath, even deeper than before. Expand that diaphragm and your biotensegrity of your body. And go to the front a little further. And last one, deep breath, even deeper if possible. And then extend, do a little heel raise if you can, lean back and finish. Hopefully you enjoyed that. You can have a seat. While you're getting comfortable again, Handspring Publishing gave us this slide to show you. If you're interested, this will be here for you to access, but you get 25% off the pre-published book. It's not published in USA yet. It will be in August, but there's a discount there and a code, NTL825, if you're interested in getting the book. So, Anne, we're going to get into the stretching. I think we're going to go through the book, and you could always ask questions. But Anne's going to talk about chapter 1, the emergence of assisted stretching, because this is a very interesting story. Take it away, Anne.
So one of the things that I find delightful is Susan, when we were chatting last week, said somebody had said something about and actually referred to it as the S word, like it had become some sort of controversial, dirty thing. And I find it really interesting how I started, you know, dancing 45 longer than that years ago. And stretching is something that dancers just have to do out of necessity. But what's interesting is I think it comes down to defining what the word means. And I think it's a misunderstanding of the word itself. So Chris and I have gone long and wide and stayed on top of the research and really have seen this, the topic of stretching go from nobody caring about it to it being popular, to it being very unpopular, to being popular again. And now it's back to the questionable. So it's kind of interesting how it has gone through this evolution. And I'm going to let Chris talk a little bit about the definition, because I think this is where we start with trying to educate and answer some questions about maybe the misunderstanding of what the word itself means.
So I'm going to keep everyone in suspense because I'm going to build towards those actual answers of what stretch is.
Okay.
So then there's that. All right, so I'll share the screen again. So that's, we actually go into the research. We go into the whole history of stretching and basically where it was and where it is now in the book. In the second chapter, we talk about research, and actually we did our own research. So we talk about general stretching research, which actually is poor quality. There's very few high quality studies. Anne's going to say a few words about why this works. At least we did a study about it, and we related it to chronic low back pain.
So I did a study originally for my thesis work in '97 that I defended in the biomechanics lab. It was actually the dance department and the biomechanics lab synergistically, because I was bridging both of the fields to create something the way I was looking at it, not realizing quite honestly what I had stepped into. So I did research back then, and then we were able to do it again with Dr. Paul Standley at the University of Arizona Medical Center a few years ago. And we actually presented this poster in Berlin at the last FST. One of the things that is imperative is that you get clinical-based research that has a human body involved and has some sort of validation of what you're trying to do, that has that magical, the scientific significance of making a difference. So we took 8 basic moves. It was some of the folks we saw as little as 1 30-minute session. And my goal is to see how little we can do from an intervention standpoint to get gains. So it was an interesting thing, because the main thing that I realized is how compressed, and this goes into the tensegrity piece, how compressed people are and how unbelievably stuck they are, particularly when they stand. The group of folks that we had as the subjects were mainly medical students that were standing on their feet on cement doing surgery. And by the time they came, they were very, very exhausted and dehydrated and compressed. So that just that decompression, that down regulation, I found was pretty spectacular with making a difference in basically their ADLs and then their pain factors as well.
I just want to say now, if you attended another webinar hosted by Handspring on Wednesday, this is not the same. This is not going to be the same discussion. There's a little overlap because we are talking about the book, but we're getting into biotensegrity and how it relates to fascial stretch therapy. So excited. Is there any question you want to ask now, Susan, or shall we?
No, keep going. I realized I was going to do a presentation before you started, but maybe we'll either forego it or stick it in a little bit later, because it sort of relates to what I see you guys is doing, which is we're talking about the concept of applied biotensegrity.
Well, Anne will talk about this too, and both of us. With our 10 principles of fascial stretch therapy, anybody out there, part of the biotensegrity group, we are really interested in continuing this, we're starting this dialogue.
Absolutely.
And we would love to just continue this dialogue. How is it? We know this stuff works. How it works is always the question when you get down to it. We're always trying to find that in research. So any ideas from the biotensegrity group that you may pose as to why some of these things are actually working from a biotensegrity perspective would be extremely helpful. We'd love to hear about that and even share in this webinar.
Well, and I also think opening the dialogue of the importance of getting clear on the stretching debate and whatever we can do to add to the understanding collectively is what we're all about.
But without really going into the meat and potatoes of the 10 principles, it's based on some sound foundational principles. At least we feel that way in our heads. Hopefully it makes sense. But these are principles that we have discovered works as we evolved, right? This happened over the course of 20 years. We're still evolving. Yet Anne had the system developed in 1998 when I met her. She already had the system in place. Mm-hmm. But it has continually evolved, and we're happy to say that biotensegrity is a big part of that. So here, okay, everything's about assessment. If you're helping someone, I'm a physical therapist. So if I'm trying to get rid of pain or trying to solve a functional movement problem, it's all based on your assessment. You don't lay a person on a table and start working without doing a proper assessment, as most of you know. So these are some of the familiar sound models I feel that integrate with fascial stretch therapy. The first is the fascial system. We use the definitions, and they posited new definitions. There's the fascia system definition versus fascial tissue definition. A lot of you who work with fascia and attended the Fascial Research Congress know what we're speaking about. But basically, when you look at the tissue itself, that's for research purposes, more of a histological discussion about does fascia stretch as a piece of tissue, singular tissue. Yes, in some cases it does, and no, in other cases it doesn't. It depends on the type of fascia we're speaking about it. Dense connective tissue, not so much, doesn't stretch so much. More elastic tissues, yes, hence the word. So we're really incorporating the fascial system, which is much more diverse and complex, and of course, many less studies in that area because it encompasses so much. The next is fascial anatomy. Anne had the system in place, but we later got trained with Tom Myers with the anatomy trains. So you may see some similarity with the anatomy trains paradigm and concept, of, at least with body posture and other things. Mm-hmm. Here, and highlighted in bold, biotensegrity, self-regulating tensional network, and we'll talk more about that. We also incorporate the biopsychosocial. That's been a big buzzword for the past 5 years, otherwise known as body, mind, spirit. I just put it in those terms. It covers it all. When you work with a person, you work with the entire person. I don't know if everyone has heard of regional interdependence model, but basically it means where it hurts ain't where the problem is. It could be far distal. Mm-hmm. And so physical therapists have done a lot of research in this and just substantiates the biotensegrity model as well. And last is pain science. I took a quote, pain is a mental construct. Is it always in your head? Of course not. But it's a big part is in your head and how you influence a person emotionally, mentally about pain, in addition to function, is extremely important. Okay, let's get into the teeth of stretching here. So the research, I have looked at research that supports what I'm going to posit this. I don't know if anyone else has used this term. I'm not saying I invented it. I just call biotensegrity, forgive me, biotensegrity group, but I'm just going to put this out there. if it's okay, I'll just propose this. You could say, no, we hate that. Stretch activated or stretch dependent system. It's a very primitive term right now, okay? So I'll start with cell channels. And this is the reason we're going to look at research where we look at the word stretch from cellular on up. So here, mechanosensitive, let's see here, I got to shorten this. Mechanosensitive channels exist in all cells. And the next quote, local mechanical stress can be produced by far field tension, the cytosol skeleton, for instance, the extracellular matrix. These are quotes from the research you see below in 2010, stretch activated ion channels, what are they? And it's just a cellular way of saying, this is another, I think, research that supports the idea that we are a human tensional network, which is biotensegrity. The next would be stretch activated calcium channels. If you just look at the bold title of the study, it says regulation of cell movement is mediated by stretch activated calcium channels. More evidence that from the inner workings of the cell itself, and within the cell, there are stretch activated gateways and channels that catalyze all this. Mm-hmm. Paul Standley came out with a study, it's down below, it says in 2009, he found 90 seconds of simulated manual therapy, which basically stretched. He did pressure and shear, which is a myofascial release technique that osteopaths use. He tried to mimic that. It strongly reduced the effect of 8 hours of repetitive strain injury through the matrix. So in other words, he reversed cell death, which is called apoptosis, with mimicking a stretching technique. Helene Langevin, medical doctor, did a lot of studies. Don't look at the detail. This is from 2008. It just basically looks like the effect. Just look at the title, please. The effect of stretching on the resolution of inflammation with connective tissue. That's one. This is another study in 2012 that basically found the same findings of stretching reducing chronic inflammation in a mouse. And then here we have the effect of stretching on the resolution of inflammation within connective tissue, another similar type of stretching, but it's kind of interesting. She calls it stretch-induced fibroblast expansion from the stretch, obviously, involves extracellular ATP signaling and connexins. I don't know what connexins are, but it goes down to gene transcription and other cascade reactions. The next, did you want to ask a question about that at all, Susan?
No, right now I'm just happy.
Okay.
And you're talking about this. Well, it's always interesting to me whenever I see the word tension in a research paper or tensility or that sort of thing. And I think that's what you're highlighting, is that here we have this whole system, fascial, multi-directional, omnidirectional webbing, which when you move one small part, do something with any small part, the rest of the system is affected.
Yeah, precisely. That's a very well said way of explaining something I wanted to explain. So thank you for doing that.
Well, I'm stealing, Chris knows this, I'm stealing from the Tai Chi classics. When one thing moves, everything moves. Which didn't any sense to me until I found biotensegrity.
These are universal principles that I think people like you, I, and the people attending are looking for, so we can speak somewhat of a common language that's common to living here on Earth and something that we can all relate to. So I love it.
Yeah.
So the next thing here, if you bear with me, can you see that? Tissue hydration and stretching?
Yep.
This is an unfinished slide, so I apologize. But the point is, there's a lot of study on how stretching and hydration work together. It's incredible. Protein interactions are highly dependent on water, it says here. Surface hydration is essential to the protein structural stability and flexibility, or mobility. So we always talk about mobility, stability in fitness, in physical therapy, in Pilates. Well, this is proteins. If your proteins don't have proper structural stability and flexibility, do you think your muscles will? Of course not. So this goes down to that level where hydration is affected. And if you're dehydrated or not hydrated well or properly, there's problems down to the protein level. The last thing here is NMR, nuclear magnetic resonance imaging, demonstrated water extrudes from tendons when loaded during stretching. So they feel that, for instance, with the Achilles tendon, when it's stretched, it extrudes and it actually helps hydrate the tendon itself and actually helps milk all of those fluids, but it's a dynamic process that goes back and forth. It superhydrates and then it comes out. So when you stretch, there's a superhydration effect where the water content increases beyond where it was before. And that actually increases the elastic stiffness. So we talk about being dynamically flexible in sport. That doesn't mean loosey-goosey like you can do the splits. You would injure yourself. That's where the studies have it wrong. We know you don't do a static stretch for 30, 60 seconds or whatever right before doing a vertical jump. Studies show it will decrease your jump and probably make you prone to injury. That's when all these journals start saying, should we really stretch? Maybe not. Maybe we shouldn't stretch. And I'm like, are you kidding me? This was one study or maybe 10 studies just about one type of stretching. There's a spectrum from static, not moving, to ballistic, and then so many other ways to stretch in between, which we haven't studied. And they draw these conclusions, maybe we shouldn't stretch based on static stretch only. So that a lot of the misunderstanding about should we stretch or not comes from actually the popular media jumping on those studies and being a little bit too premature in their conclusions. And now it's come full circle. Now it's all the rage. Everybody wants to stretch.
And just like the words tension or compression or so many of the words that we're working with when we're working in this field, you can come up with so many different definitions. So when somebody says this doesn't happen, or you can't stretch this, what do they mean? I can certainly, my grandkids wake up in the morning and yawn and stretch. Or do we have to tell them you're not stretching, you're pendiculating, or externally we're moving in reconfiguring our bodies, tensioning things, breathing, it's happening. So, and we see animals, all kinds of animals doing it. So something about some form of stretching seems quite natural. And now it's a matter of how we talk about things. And I want to also say, I'm going to follow up later. I look forward to following up on that research with the tendon. We think of the body as being soft matter, so it's not water wet. And so although sometimes it's helpful to, when you're doing a sort of idiokinesis movement thing with somebody, say, feel like a sponge. Now squeeze your sponge like you can squeeze your air out or you can squeeze your water out. Now expand in all directions like you can let stuff in. It's not water wet water in the system. It's soft. It's soft matter. It's got properties that are not liquid or solid.
I would just say right now, if you want to know more about water, look up something like The Fourth State of Water by Gerald Pollack.
Yes, we love Pollack's work.
Right, so there you go. So, but I don't think people, that's a really good point, Susan, use the concepts, even the ideokinesis part or the imaging of water in your workout. And we are fluid beings. We are mostly water. We're bulk water, we're bound water. And we're different kinds of water within the human body. And how to use those concepts, though, in movement, that's how you move in a fluid way. Fluid means water-like. And so in martial arts, I'm also a Tai Chi instructor and a Qigong instructor like Susan is, we seek to move like water. Bruce Lee said to move like water. And he's a hard style martial artist. But any martial artist knows that you need to do soft, smooth movements for healing. You can use hard, linear movements to kill, unfortunately, a lot of that's why it's called martial art. But you need to use softer movements, more fluid-like movements for healing of the martial artist who trains very, very hard. So
and I think that Rachel's got a lot of questions lining up, and it looks like she's on screen ready to share them if you want.
Rachel, what you got?
We start with a question from May Kessler. And May, I can unmute you if you'd like to ask your question yourself. There we go.
Which one? Which question?
It would be your first one in the chat. That's the one that I'm speaking to right now. You're talking about hypermobility in that question.
Yeah. Okay. So good. So yeah, I'm a dancer too. I've been dancing my whole life. So I love to. Yeah, I didn't know about you guys. I'm so thrilled to learn more about you. And also my brother. I wrote it. My brother's an architect too, and he went to Pratt.
Okay. One in common.
Yeah, we're choreographing a dance right now, talking a lot about trying to work together between what he learned about tensegrity and movement, and showing that in movement, which is really exciting. But then COVID happens, we can't rehearse. But that's not the question. But I'm excited to tell you about that. But so the question is, yeah, I also see a lot of dancers, and of course, I mean, all you need to do is turn on World of Dance. I mean, these kids are going like, you know, wow, that's a leg. Going to, 4 o'clock where it should only go to maybe 180. What is happening here? And of course, they're all getting this hip pain. And so I stretch. They all, and yet they still come. They still want to learn how to stretch more. So yeah. And then I have so many patients, adult and otherwise, that are I'm really seeing it. Hypermobility in some places and then really tight in others. I understand how that happened. But they all want to stretch. The yoga thing, there's everything. So stretch, and I guess I'm like, where are we going? How do we fit this in?
So guess what, May? Thank you. Appreciate your question. If you can be a little bit patient, I'm going to get to answer your question, I believe, and you can always come back and say, I have another question, or that didn't quite answer it. But I think when you see our paradigm for assessment, it addresses exactly what you said. According to our biotensegrity, if we look at the fascial net as a biotensegrity structure and function physiology, you'll see what I mean. Is that okay?
Well, do you want to get to it now, or do you want to wait for it?
I think it's my next slide.
Oh, wow.
Okay.
So I'll share.
Coincidentally.
Yeah, as it all works out. So that's hydration. Well, I'll just say this real quick. Tension in a human cadaver. We were at a we were in dissection lab with Tom Myers. This is just a psoas. So if you can imagine, Tom stood behind the cadaver. The cadaver is unembalmed, so untreated. And I said, Tom, in front of all these people, I said in class, Tom, I'd like to try something. Stand and block the cadaver so it doesn't roll off the table, and palpate the psoas at L3. I said, I'm going to hold the leg in neutral to the torso, so no stretch on the hip flexors. I didn't want stretch on the hip flexors. And then I simply flexed the knee, I bent the knee, and I said, please tell me if you feel any movement here, proximal, when I move a limb distal. And everyone saw the expansion of the psoas slightly, and he felt and palpated. I did it repeatedly to confirm that even in a cadaver where there is no water, right? There is no blood, there's no hydration, he felt the movement. So even the passive biotensegrity, the passive system of tension, obviously is still intact because we didn't cut apart the whole body. And he was able to feel the transfer of force right up proximal when I moved it distal. So I just wanted to share that with you. I think that substantiates the biotensegrity. Okay, new definitions. So based on lots of research from macro to micro, I proposed a new definition. You could say this is a bunch of malarkey, Chris. We don't believe you, or this doesn't make sense. But it's a starting point. It's not the only definition, right? You go to the dictionary, there's all kinds of definitions for one word. So here's one in terms of how we work with the body. I'll put it as this: any mechanical stimulus that extends, expands, or lengthens cells, tissues, organs, systems, in contrast to slackening them. So we're going to get to May, I think, where I was talking to May.
Yeah.
We're going to get to you about this. So we're going to use this concept of slack tissue and stretch tissue and stabilizing tissue a little bit later, coming right up. The next thing is, by extension, we usually stretch to get more flexible.
Mm-hmm.
So flexibility, defined by the largest, most respected strength and conditioning organizations in the United States, they simply define it as range of motion. I disagree. It's way beyond just range of motion. I just reworded here, and I'm not saying I'm the first person to say this. I don't know, I haven't seen it, but here we go. It's the ability to adapt to external and internal stressors. So inside your body, you feel like you need to stretch because something inside your body feels tight. That's an internal stressor. And an external would be you're sitting on a chair and the compression from being on the chair, the chair is squashing your butt. You need to stand up and do something about it. Those are the stressors. So it's the ability to adapt to those stressors and return to homeokinesis when you're active and homeostasis when at rest. So does anyone have questions about that?
Go back and I want to address your question.
Yeah, I'll just do this.
So May, I want to address it specifically because we deal with this all the time with particularly the dancers and the yoga folks that are always looking for that extra edge and that extra range. One of the things that we find is so much of the time they're so overstretched and weakened in positions that they push and push. The leg up over the head is probably the perfect example for the dancers. One of the things that we try to do is we try to balance, if you will, the net so that there is more of a equilibrium of where it is being distributed. So much of the time they're stuck in the joint capsules and they can't get to that themselves. That's one of the basis of our technique, is to get the joint capsules opening so that they don't push into the ligaments, and also that they are stretching into the corners of what really need to be opened and not into what's already hypermobile, but trying to balance and create stability, particularly in the tendons and the joints.
Here's another thing, May, and for those who are listening, so I've worked with the New York City Ballet as their physical therapist with a team of other physical therapists. Kudos to Westside Dance Physical Therapy. That's the place I worked at. Amazing company. So I worked at Lincoln Center in the theater, and I every week, twice a week at the theater, and I went to Brazil with them and so on. The point is, let me see, what was my point? Shoot, damn it.
Here, I'm going to show something while you it bubbles up or not, and if I may, and then we can get back. But I just want to say, in terms of that lengthening and such, and just following the model, you'll see that when I pull this model, if you can see, it expands in all directions. And I think almost everybody's already seen this before, but I just feel like we can always revisit. This is what we call that auxetic response, where it's an omnidirectional expansion and condensation, which I think every one of you who does any work with the body feels through your fingertips anyway. So when you talk about Tom Myers feeling that top, that more proximal end of the psoas expanding when you move the knee, I'm thinking of that expansion in all directions.
Yeah, and my thought was, thank you for that, was dancers, when I had dancers in the School of Ballet here in Arizona, I was the physical therapist for Ballet Arizona. I advised the students, stop static stretching right before class. Injuries went down. They were warmed up much quicker when they did dynamic stretching and started to do more, fluid movements before you take a serious, intense class. And after is the time to do more static, slower. So we call that doing the stretch wave. Do a slow, very slow stretch wave post-activity for recovery, and do a quicker, 3 times faster even, movement before activity for preparation. That's a big deal with the dancers. The young kids need to learn good habits, and the bad habit is, I need to do the splits before I start dancing. No, you do not want to do the splits before you start dancing.
Wow. So there's always going to be more to say about anything. I know, Rachel, we've got more questions than we probably have time for. So let's maybe get to the next one.
Okay, the next is Joe P. I'm just going to say P so I don't murder your last name. And you're unmuted, and you're a great guest in the sports Biotensegrity Tea Party. So
P. Joe
I apologize. P. And Marty has actually 3 questions in the chat, so maybe he can combine them into one mega question. I don't know if
Okay,
he wants to.
so
There we go. Yeah.
so one question I have is, I noticed in the definition of flexibility, there's no mention of motor control in the definition. Is that done purposely, or?
It's an incomplete definition. It's really more of a, how would you put it, a nutshell definition to get it out there as a starting point. And you raise a very good point. There has to be motor control, and it could be further defined as such. If you want to throw in your 5 cents, Joe, go for it.
Yeah, I know. I just, you know, first of all, I really love the concept that you're doing there, involving the entire kinetic chain and the stretching, almost kind of like a yoga approach to static stretching. By the way, is it static stretching?
No,
it's not.
It's as far away from static as you get. It's not. It's perpetual movement from micro to macro, but it's perpetual movement. There is nothing static about it. It's breath-based, but it's very, very movement-based. And it is different in that it's a modality that I developed that is collaborative with the person that you're working on. So as opposed to the practitioner doing it to them or on them or at them, it's with them. So you are blending your motor systems together to make it happen.
Maybe you guys have a film clip that we can see at some point too. And
Probably going to make you wait for that. I know him.
oh, okay. Joe, go ahead. Sorry. Didn't mean
What
to-
else, Joe?
Yeah, and so the other question I talked about, where, you know, when you talk about the reduction in inflammation, so whenever there's a study like that, I always look like, you know, compared to what? Because am I right that really any type of exercise really creates that kind of tissue pumping effect that helps reduce inflammation and edema? Am I correct in that, or?
You're totally right. There is not one technique that does it all or does everything. So you're right. Anne has taken stretching, and I evolved it with her to make it a specific to stretching, how you can get pumping with our stretch patterns that we put into it, if you will, as opposed to another way of doing it. Of course, you can stand up, just like I showed you the stretch where it's a pumping activity where you do a heel raise. It's just a heel raise, right? But actually, it's not to strengthen your calves. The purpose, you would do it differently to strengthen your calves than you would do it to pump the fluids. It's a lymph exercise. So that's a totally different way totally different concept. So we have similar things with table-based approaches working on someone, as opposed to traditional stretching where their paradigm is an isolated stretch, just the hamstrings, linear plane. That's what I'm doing here for 30 seconds. We are so far from that. We don't do that at all, that we keep moving through the biotensegrity, the entire body, to explore and assess where is the movement deficit, where are they dehydrated, where is someplace hypermobile in the fascial net, and it's hypermobile versus hypomobile. We need to stabilize this area while stretching that area, but not stretch what's too mobile. So it's a whole study that we've done to really fine tune the assessments, so you know exactly what you're doing and how to get the change you want without involving other tissues that you don't want to stretch.
So it's about compliance and tissue mobilization.
Okay.
Would you say?
Yes.
Yeah, absolutely.
That's a great way to say it. By a lot of ways to say it.
Thank you, Joe.
Yeah, thank you. Looking forward to the rest of the presentation.
Sure. So, Sid, do you want me to? Is there another?
Let's go back to Rachel for one more.
Yeah.
Rachel, do you have like 20 questions?
I definitely have at least 2 more and possibly 3. The next one
we take one more, and then Chris, whatever you want to present after that.
Yeah, just Rachel. I'll go for Rachel's cue. She'll let me know.
Yeah.
Okay. Next we have Carol Davis, who also had multiple questions, and maybe she can condense them.
Great. You guys are stirring it up today.
Yeah.
There we go.
What can we answer for you, Carol?
Wait, oh, there we go. No, I'm having trouble unmuting her. Maybe someone else can help me. It's not unmuting for some reason.
Carol,
I'm trying to. Oh, there
Okay,
she's
there you
right
go.
now.
Oh, there we go. Thank you.
Okay, Chris and Ann, I'm with you so far. I'm so glad Ann brought in the piece about your interaction with the patient, with the client.
Yes.
That it's very dynamic, breath-oriented, movement-oriented. You're not just sticking them in a position and instruction. And your presentation didn't really bring that out. And I think that that really needs to be brought out, that this is a dynamic interaction between what you're reading with your whole body, as you'll get into that, I'm sure,
Yes.
as you're feeling with your whole body with the position of the limb. But I just can't get around this idea of using the word stretch. To me, stretch means pathology. It means stretch marks. It means damage, and elongation or unwinding or elongating within the biotensegrity limit. To stretch is to go beyond that and to cause injury. And so every time I hear that word stretch, I have to do a thing in my head. So that's not what they mean. That's not what they mean. They really are talking about elongation. They're really talking about unraveling, as May put, unraveling the collagen and bringing the elastin back to its normal or optimum length. But I just wanted to offer that to you. Now, you've built a whole industry, I hate that word, a whole practice around the word stretch, including both your books.
Yep.
So I know that that's a part of the process, and the world thinks about stretch in that way. But my sense is the more we get refined about our language, as the more we understand this tissue, the more we're going to call upon you to be more precise with the words that you use. And I just think extensibility or unfolding or elongation is so much more accurate to what we can picture inside what's happening in this tissue as you work and energetically with what's going on, that you're picking up from your proprioceptors and interoceptors, and they're picking up from theirs. You're really working in concert in a kind of a dance, if you will, rather than rip. You know,
okay. Let me address that because it's perfect. Thank you, Carol. It is a challenge when you get pigeonholed into a word, right? And unfortunately, when I started this, I didn't know this was all going to evolve. So I had no idea that this adventure with the word that seemed very benign when we started was going to cause such adventure. So the concept, and I thank you for for sharing that it wasn't as clear as to what the modality is. It is a synergistic dance of two people together. It is a relationship that is safe, that doesn't have pain. And the way I look at it is I listen to the tissue and I decompress where they're stuck, and I allow that movement to occur where it needs to occur. So and I think probably the best thing in the whole world. Have you ever experienced this, Carol? Have you ever been on a practitioner's table? Okay, I would. I'll talk to you further about so you can.
I've experienced Barnes myofascial release, in which I do exactly what you're talking about. I think I'm doing exactly what you're talking about. You call it something different, but I'm doing the exact same thing.
And I do it where I wrap their body around mine to move them. So it's a bigger dance, if you will.
Yeah.
So I think there's lots of adventure to clarifying, because when you are a leader in a field, you have to be very clear about defining it. So we can continue dialogue.
Yeah, and that's also why I want us to see it when you're ready to show it, because to me there's almost like the Tai Chi push hands, where two people are functioning as one of the teachers I know says, you're one chi. And the problems come when you're getting your ego or intention in there or your agenda in there, and you break and you become two separate rather than one chi.
Yes.
And the good stuff can happen when it's all a blending. Now that's Tai Chi terminology, not scientific terminology.
And when I've had Qigong masters on the table, they say, you know what you're doing, you're moving the Qi. we move the chi together. So it's dancing Tai Chi. Maybe we should head down that path.
Is another question, or do you want me to continue?
Well, do you have a clip showing the technique? Is it premature? Because we actually,
I'd have to look for it.
We've been here for an hour.
Oh my goodness.
Amazing. I told you the time was going to fly, guys.
Indeed.
And I want people, I feel like when I go to your website and I see that sort of dance, that ballet, that connection, that connected movement that's happening between you and the clients, I feel like there's something that comes across that transcends language.
Yeah.
Absolutely.
I think I didn't incorporate I thought I had a video I don't have one in the PowerPoint, so I would have to find it while Anne maybe describes the stretch. Here, I'll show you. Let's see if I can do this, because I don't really have it. 1 second. Stop share. Oh, here it is. Sorry.
Rachel, maybe is there another question while we're searching for this?
Yes, we have a question from Eleanor Silverstein. Let me see if I can unmute you. Yeah, you're unmuted. This is a question regarding Parkinson's, I believe.
Okay.
Yes, I'm a Feldenkrais practitioner, and so we don't do the stretch thing, and I'm loving what you're saying. You are opening my eyes and mind. Of course, now it got me thinking. When you did having us stand, the 60-second thing and stand, and that action, and talking about the water, I'm saying this incorrectly, so help me with it, but this is what got me excited. You're talking about the water moving, the fluid flow when we're going onto our toes and with the heels. And it got me thinking about, not thinking pathology wise, but thinking about people who have Parkinson's and aging, just aging, where people walk flat-footed. They don't get that action of the suppleness of the heel toe, and the springiness. So can you talk a little bit more about that? Because it's not just to the extreme a neurological condition, but it's part of an aging thing. And maybe we don't need to know what comes first, but can you talk to us a little bit more from your point of view, how you see that?
And I'm just going to jump in and say a week, 2, 3 ago, Wilbur Kelsick was talking about how people are not picking up their heels.
Yeah.
And then they get into that shuffling. So great.
But they're not just not picking up their heels. It's a systems situation, right? It's like, because it's so internally biological for us to innately do that. So let's say something innately is starting to go by the wayside. You're creating something that's helping feed back the loop, possibly to increase that potential activity.
We're putting spring back in their sprockets. They need their springs back. They've lost their springiness, that absorption, and that's the whole thing about the shrinking, the dehydration, all the things that happen with the elderly and those that stay in a seated position for too long. That's why we drink margaritas here early in the morning in Arizona. Hydration. No scurvy too. There's vitamin C in there.
So real quick, Eleanor, yes, Parkinson's, it's a central nervous system disorder. That's a different animal than you have what they call the old man or old lady shuffle.
Right.
And they don't have Parkinson's, but they still shuffle and they don't pick up their feet. And you see that's very common as people age. Part of that is if you see an active aging person, they don't shuffle. They can be 80 years old and they look like they're 60 still, and they don't shuffle. They pick up their feet versus someone who stopped moving and they're shuffling. And not only are they 80, they look like they're 90 and they move even worse. So you have this contrast between biological age and chronological age, right? An 80-year-old could move like a 60-year-old or 100 or a 90-year-old. And so that's part of it, is where they movement is medicine, right? So if they stop moving, inherently the whole system starts breaking down. They're shuffling for stability. because you start picking up the heel, you're inherently less stable.
So what are you saying? What are you both saying that people can do to help assuage that from happening? Because I'm seeing it in people in their 60s.
Yeah, this is a good example. Our basic training in level 1 fascial stretch therapy, for instance, that we teaches the practitioner how to decompress people. We actually have adults grow 1 to 2 inches because they regain the height that they lost by getting decompressed. Okay, we're not talking, you know, compression fractures from some serious issues in the spine, but any space you can create in the body, and now called spatial medicine, that's what Tom Myers calls it. If you can create more space, it helps the biotensegrity. All of a sudden you have more stability, mobility in the biotensegrity of the human body, in the network. And now they can pick up their feet. I've had people start to pick up their feet and have increased stride length. They're picking up their feet. And basically it's a cascade. Everything changes for the better. Even in an 80 or 90-year-old, we've seen this. It's never too late. But the principle of decompression, we manually, I don't want to say pull you apart, it's non-painful, but we create space with analysis and assessment. Where do you need it? Where do you don't need it? And we literally create space wherever you need it, such that now fluid flow is better. And everything starts to kick in a better way. I really feel that we're restoring the biotensegrity after it got caught into this wicked trap, this phase of degeneration.
Or we might say restoring a more optimal balance.
Exactly.
Yes, right.
Exactly.
Because at all stages it's a biotensegral system. From the biology perspective, I'm throwing that in. It's a language thing again. This is great. Did you find a clip, Chris?
Sorry, I would have to look for it. Sorry about that. I can go to
I'm going to assign you to look for a clip while Anne takes a question from Rachel.
Deal.
All right. I'll go to YouTube and find it.
So next we would have Craig Nevin, and I will unmute him. So he should be all ready to go if he wishes.
I'm trying to. Can you hear me?
Yes.
Okay. Well, I'll leave my screen off. I don't know why are you talking to me? What did I say? I said.
Craig, did you have a question for Anne and Chris?
No.
Okay.
I just made 2 comments. They weren't questions.
I apologize. I thought maybe a question's related to your comments. Okay, so along that line, Annie Gilmer, do you have a question related to your comment? Let me unmute. I'm trying to unmute her.
And folks, let Rachel do the unmuting.
There we go.
Sometimes we get into an unmuting dance. Well, I've done this with Rachel, where I'm trying to unmute myself and she's trying to unmute me, and I end up remuting myself.
Thanks, Susan. Okay, Annie, you should.
Yeah, the question that I had was relative to what Carol had said, which is the ongoing dialogue that we hear in the biotensegrity group when we use the word stretching. And it seems, Anne, you've tried to address that in its terminology. John's teachings have always been so specific with terminology that my question went back to saying, if you do use stretching, what is the tissue you believe is actually stretching?
Well, I think the concept of being clear about what is actually stretching is, I think there's multiple things that are stretching. And I think the concept of the fascial sleeves being stuck to the musculature is one of the things that those of us that have been in the tissue work have been working on. So I think one of the things is not isolating anything to be specific to just a muscle, because I think, as we all know, you can't move just an isolated muscle. The entire tissue or the multiple tissues come along with it. So I think it's more a matter of feeling and and assessing where something isn't moving in a range that's necessary for normal function. So it's a difficult question to be extremely specific, because quite honestly, I'm not exactly sure what is moving. I just know when it's not moving, and when we get breath and some relaxation and multiple directions, the range increases tremendously from there. Did that help at all?
Yeah, seeking mobility.
Yeah, seeking, that's exactly it. And quite honestly, there are so many systems in place.
All right, now it's time for sack of buns. This live.
My video's playing. I found the video.
Found the video.
Can I chip in on this?
Please.
I just want to say, so when I think of stretching, I just think of it in the macro term. You know, I mean, this is me personally. This isn't any official canon. I'm just saying, I know that since I was tiny, little kid, I'm gonna get up and stretch. Does anybody say, after they've been sitting at a table or, having dinner or whatever, and they get up afterwards, does anybody say, I'm gonna get up and pandiculate. I'm gonna get up and reconfigure my cellular structure at all levels, micro to macro? Nobody, we have a short little word for that, one syllable, stretch. And I'm not for one moment thinking I'm deforming my tissues. I'm not using the word that way. So it is a language thing, absolutely, because this reconfigures, this changes its shape, and it does things, and it does it without any individual part deforming. It's a matter of the geometric configuration that allows for this reconfiguring through the entire system.
An example, Susan, is in the hospital, you have to turn people that are unable to move. If you're in a coma, you need to turn the person, otherwise they get bed sores from not moving. So that we who are not in hospitals, like you and I, after a while, you need to get up. Now, there are people who have trained their bodies not to get up because they don't listen to their body. They are persisting through a project for hours and haven't stood up. That is bad for their health. And they've trained their bodies to ignore signals, interoception and exteroception, internal and external information that should tell the body, get up and move. A lot of people turn that signal off. And so, I feel only those who are aware, who maintain that awareness and listen to their bodies, actually benefit from that and will do what their body tells them to do, but others don't. And I think that's a big part of the problem.
So the other thing I want to tap on for everybody, and I think this may help clarification. When I started doing the research 25 years ago with creating this, I went to the science library and I found an article that said the two most restrictive things in the human body for lack of mobility were the joint capsules and the fascial system, the connective tissue. So I started basing the technique around that it was getting the joint space to open up and then all of the connecting parts. And that's where the dance started. So for me, it evolved from that. And I think Chris finally has a clip, which you have demanded, which is not the best clip, but at least it's something. It's the famous sack of buns in action.
Well, I'll tell you, also people are madly passing around links to your website so they can go there to see.
Well, do you see that?
There we go. Yes.
The other thing to go away, hide.
Okay.
Thank you. Okay, so you can see the beginning. So we'll see how far we get in. This is an instructional video for students who have access to our back end. So once you take our course, you have access to all these videos, so you never stop learning. So you tell me, you can control this if you want.
Is within the functional, spiral, lateral, and a little bit of the superficial back net. So it's a combination of nets that we're going to be able to target on this. It's a culmination of the low back warm up into the lateral spiral piece. And this is the last piece of it. The first thing we're going to do is we're going to go to R1. We like to call that taking the slack out of the sack. So you're going to slide your body towards the top of the table. Their leg goes anywhere from above your hip bone to your waist to onto your ribs or even onto your back if that's more comfortable for both of you. My inside arm will wrap around and hug those leg bones into your body for a good firm connection. Outside hand will go on the lateral malleolus, which is your fulcrum point for the stretch. You got to make sure you maintain that the entire time. I'm going to check in with my partner to make sure I've taken that R1, that slack into the sack. Does that feel good, sir? So you snuggle up, and I'm going to slide into that. I'm going to go from a sitting position, and I'm going to stand to lift, which is my first cue. I'm going to take his entire leg, the thoracolumbar, all of these pieces coming together as I lean away from the table. Then I'm going to bend my knees and pivot my hips, which is the third cue, in order to rotate those leg bones using my body to do that. There will be 3 PNF cues that are possible here. I'm going to have my client roll his hips down for the proximal PNF. I lift, I lean, and I pivot, increasing that rotation using my hips to increase that rotation. I ask my client to pull his knee down for the middle piece. Again, I lift, lean away for the traction, taking their whole leg with you. Pivot, increasing that rotation a bit more. The last piece, I'm going to have him press his ankle up towards the ceiling, the distal aspect of it. I lift, I lean, I pivot, and I rotate through. I check in and I look at my client to make sure everything is good, that everybody's breathing. And on the exhale, I easy release off. And I slowly walk myself back out. Common mistakes for Sacca burns. I would say.
I love it.
Is that all right?
Thank you.
That wasn't the smoothest dance. That was more educational, but you get the concept.
All right, we have more questions.
Our next question is from Chris Clancy. No, Chris, whenever you're ready. Let's see. I'm trying to unmute you. Where are you, Chris? Okay, well, it's not letting me unmute. Can someone else see if they can unmute?
Why don't we
She
just—
looks unmuted.
you know what? She also is having trouble with her battery. So we can come back to Chris if we need to.
Okay, so then next will be Elizabeth Larkham has a question. And let me see if I can unmute Elizabeth.
And I think at some point back earlier, I thought Kelly had a question.
She had a comment.
Okay.
Kelly, and that was from YouTube. I'm happy to read that out. Lisa, will you see if you can unmute Elizabeth?
Yes.
There she goes.
Oh,
Okay.
there she is.
All right.
Yes. Back to the discussion regarding which tissues are changing how during the FST sessions. I was wondering, have you had any opportunity to combine or to collect ultrasound imaging either during the session or pre and post, recognizing that ultrasound is its own difficulty?
It's on the list of studies, Elizabeth.
It's our next study.
The challenge always is studies are very labor intensive, and we were about ready to go in and do it again, and COVID hit. So hopefully we'll be doing that, because I think that would be a spectacular way to measure. And I'd love to see what's really happening, quite honestly.
Yes. I could suggest perhaps that that Stephen M. Levin Biotensegrity Archive could connect you two and your program with with Dr. Bradley Fullerton from last Friday, who has a phenomenal skill with ultrasound techniques, ultrasound imaging, and his treatments. So there may be a great opportunity for
Oh,
collaboration.
fantastic. Thank you for the suggestion.
Thank you.
Yeah, and Brad said he's looking for
Oh, fantastic. Okay.
a manual therapist to work with for this stuff.
Perfect.
Yeah. Great. And who else?
We could try Chris again. I don't know if maybe Lisa can see if she can help me out. For some reason, I can't unmute anybody.
I'm going to see if I change her on here. And because her mic is not showing that it's muted on the screen.
Chris, can you talk on
No.
any of your devices?
Yeah, remember she was having battery.
Can you hear me now?
Yes.
Now we can.
There we go.
Okay, sorry about that, everyone. I'm just gonna switch over to my computer audio. And first of all, thank you, Chris and Ann. It's especially the little exercise we did was really powerful and something I'm gonna add into my own practice. What I'm really interested in talking about or digging deeper into is, and correct me if I misunderstood you, but I think you used the word stretch activated or dependent system as a definition of biotensegrity. Perhaps I'm wrong there, but what I would like to bring up is the discussion of perhaps instead of thinking of it as an overall definition, more a replacement of a way of describing the way that you're applying it in your practice.
Yeah.
Because, or maybe that's what you're already doing, but can you dig in a little more to what you mean when you said the stretch activated or dependent system?
Yes.
And it's not the idea of stretch that I'm thinking about. I also, with the name Embodied Biotensegrity, have some language issues that I'm thinking about. More the idea of, did I hear this as an alternative definition that's more in common parlance? And if so, yeah.
I agree. We have all been etymologically traumatized by the word stretch.
Yeah.
It's like one big etymological, psychological support group to get over
Lord.
it. I agree. And thank you for your patience and for helping me with this, because I certainly don't have the answer. It's just one definition that I came up with. What stimulated this was the realization through looking at research, not my opinion, how many times the word stretch came up in research as a primary thing that they were doing to a cell, to a muscle, to a tissue throughout the Fascial Research Congress proceedings. Like, I looked through it, and the Fascial Research Society and Helene Langevin, again, she's one who has done so many of those studies, all based on the concept of stretching tissue and the positive aspects of it. And so for me, it was, one more minute. For me, it was more about, it stimulates, it catalyzes, you already have a tensional network. Everything is under some amount of tension. It's not the same amount of tension. It's different at the skin than it is in the joint capsule, than it is in your lungs. There's all kinds of things. But if you puncture the lung, you get a pneumothorax.
I think I didn't actually ask a clear enough question, and I apologize for that.
Okay.
What I am really what I'm getting at is, were you saying that as an alternate definition? Because in my understanding of biotensegrity and my very, very limited understanding of the work that you're doing, you're moving the body, and there is this playing with the tensional aspect. And that is definitely part of what we're understanding in biotensegrity, the relationship between tension and compression. But for me, when I hear stretch activated, and I'm thinking in my mind, you're playing with tension and compression system, I'm thinking of only a small perspective on biotensegrity. So I am wondering if that's what you mean. And if it's not what you mean, I'm wondering if we could at some point have a deeper discussion on that.
Yeah, I think I just want to explore the fact that when you're starting to change the tension of the biotensegrity network, you can conceivably affect these stretch dependent physiological reactions within from tissue, from the cellular level all the way to the tissue and systems level.
And I think too, you're actually experiencing that. That's, you've done this, you have this 30 years of work. It's good work. So I just wanted to drop that little penny in the pond and see where it goes, and hopefully continue this conversation with you.
Well, thank you. I would love to do that.
Thanks very much.
And can I jump into the model for this? Do you mind? I always take it back to the physical models that I have, because I just endlessly turn to them. And I'm thinking about something Doug Johnson did a few weeks ago, where he just kind of took a certain section of the model and he restricted it. And when he did, you could see when you go to move another part of the model that now you're not getting that movement through the system, where if I hold here and I move here, you'll see the whole thing, you know, auxetically expanding and condensing. But if I grab a little chunk somewhere and restrict, that's going to compromise that ability for signal to get through the whole system. And I think, to me, when I see what you're doing, that's what it looks like, that you're sensing where are those places where there are those mobility restrictions, and then you're using the techniques that you know work to help restore a more optimal balance of the tenso-compressional system.
That's really great to see the model, and it started to make me think, if I don't have this video, but if I could just show you Anne or myself dancing with a client on the table, assessing. We're not stretching yet anything. We're dancing by doing our assessment, and it looks like a dance. We're unlike a massage therapist who's just standing in one place and applying these techniques. We are constantly moving around the table. So it looks very different. And all of a sudden you see me stop, or Anne stop. We found a restriction. We found something that's not dancing. The tissue is not dancing with us. And so our fascial system, our fascial net detected it in someone else's fascial net. The dance all of a sudden is awkward. It's not working. It's not smooth. It's not rhythmic. So I'm speaking in qualitative terms, obviously, like an artist, like a dancer. Mm-hmm. So we stop, and then the nuances of winding and unwinding and winding and unwinding, or going through the yin yang movements, the up and down and the side to side undulation that's characteristic of our work, to get the tissue to respond in the way that we prefer. And then we reassess to make sure, yeah, it's changing. Now stand up and retest your functional movement to make sure it's functional and it works for function. So that, it's a different, when you see the experience, when you see us or our students dance, it's like, wow, it's not like we're feeling, we're assessing, and it's an unspoken language. It's just we're moving together. It's a choreography, and it's different.
You're assessing, and you're restoring play.
Yes.
Joint play and beyond just the joints. We talk about
unsticking the sticky parts. It's unraveling. I like that a lot. The sticky parts that need the signals so that you can get the motor signals and all the fluid and all that stuff. I explained it very technically. They've got a hitch in their giddy up you need to get out.
See, I think the non-technical language is like metaphor that is actually kind of more effective in some ways. That when we get into, I'm doing this with this tendon, this ligament, this bone, this muscle, this joint, whatever, we get lost in a mechanical set of imagery. And when you say what you say, what did you say again?
I'm sticking the hitch in their giddy up.
There we go. See, everybody just knows that sounds right.
Or unlocking the power of their booty, as we say to the athletes. Wilbur will appreciate that one.
That's for the athletes.
that just transcends all of that other stuff. I
speak
love
that
it.
language more than Chris does.
Just a last note to realize there's a lot to this.
Yeah.
There's many layers to this. And we move people passively, active assisted, active and resisted. It's not just passive.
Yeah.
And it's standing, it's also in functional positions and not just on the table.
Mm-hmm.
Well, anybody who's been to 3 Super Bowls, I mean, the people who are working in elite sports don't mess around. They can't afford to.
Correct.
They've got multi-million-dollar salaries that depend on the functionality that you're bringing, you know, that you're restoring, that joint play, that tissue play that you're restoring to the system. So we know what you're doing is effective because it wouldn't get to those places without that. The proof is in the pudding, to use another technical term. We are getting short on time.
My goodness.
So I want to make sure that I'm not hogging your attention. Rachel, do you have more questions?
Actually, we're good right now. I just put into the chat for everyone that what you were just talking about, the sticky places, goes directly to Kelly Clancy's comment that you were mentioning, Susan, where she talks about hyper and hypomobility.
Yes.
That's in the chat for everyone to see.
Great.
Well,
So and we want to make sure everybody gets to see your book page again with the
yeah.
even though this is streaming and it will all be up live on YouTube afterwards, but
We do just now, I'm so sorry, we do just now have a question from Wilbur. If we
Oh,
have-
perfect. Hey, Wilbur.
Okay, let's get back to Wilbur then.
All right.
Sack of butt.
Technical.
Oh yeah. You guys make it fun.
You gotta make it fun.
Yeah.
Life's too short not to.
Yeah.
So, can somebody help me unmute Wilbur?
I hear Wilbur.
Hi.
Oh, good.
Hi, Wilbur.
Hi, guys. How you doing?
We're good, thank you. How are you?
Good. I'm fine. Great. Good. Just a quick question. I mean, the whole thing about stretching or whatever we're doing, if we think of the body as a fluid structure, which is soft matter, I think sometimes what we are calling stretching is maybe has some different physiological activities happening. But my question to you, based on your technique, is don't you think when you're doing assessments or you have somebody, if you're talking about you want to find restrictions, and so if someone is laying on the table and you're lifting the leg up to, you're feeling something different. If we consider the body to be a functional unit, don't you think that at times we are creating tension because we are creating these fulcrums, having someone laying on the table, for example, and we're looking at the hamstrings and we lifting the leg and we're thinking that the hamstring is restricted, but it really is not, because there's a fulcrum from the back, from the gluteal going up into the back. So I mean, how do you look at that? How do you kind of say, well, you know, I lay on the table and I'm doing and I'm feeling this tension. Well, that tension could be possibly be created because the person is laying with a force on the tissue from the whole in the back up into the neck and to the glutes, which is affecting everything that's going on. So how do you account for that?
So that's a fantastic question, Wilbur.
Thank you for that.
I am always looking at movement and angles and edges. We don't do anything statically from a assessment standpoint, in that I'm always considering what's happening from the joint capsules out. And I'm also interested in the spiraling of things. So I think the traditional way that like range of motion is done is very inadequate for it transferring to function. And I think a lot of times where people think things are at, pardon me?
Look in the light, Anne.
Sorry, I tend to look down when I read. When people are assessing, they're oftentimes too linear with it, and everything we do is through the movement piece and then the transfer to function. So I think the way we assess things is a very, very different way than traditionally. It's something that it makes me think deeper. You guys, this has been spectacular, Susan, because there's so many amazingly great questions that make us think deeper and wider. And I love, love, love that. That's exactly what the learning's all about for us too. So Wilbur, if we ever get to cross paths, are you going to be in Montreal next year?
Possible, yeah.
I'd like to throw you on the table and just dance with you then.
Sure.
How
Or you
about
could dance with me on my feet.
I'll dance with you however you want, honey, but it's easier to show than to explain. How's that?
Yeah. Yeah. No, I understand. Yeah, sure. I mean, it would be, I mean, I know some of your work that you've done and some of the athletes that you work with and stuff like that. And, you know, what I'm saying, I think there's something that we do to the body when we say that we're doing a quote stretching, right? But I also think based on the systems, I mean, if you talk about the continuity of the system, you know, the meshwork of a netting meshwork.
Yes.
And if we're talking about the response of connective tissue to the capsules respond differently to load. I mean, stretching is basically load.
Yes.
That's what it is. So the body, connective tissue has a very intelligent way of responding to load, whether it be an impact load, whether it be a lengthening load, and the body is designed to intelligently respond to that. And I mean, that's why, you know, if you do stretching for today and then you don't do anything for 2 weeks, the adaptation really doesn't take hold because the body realizes, well, this is not something that's happening all the time. If you have a shoe that's too tight and is rubbing on my foot, connective tissue will lay down more connective tissue and it will form a callus.
Yeah.
If I take a ring and I put it in my ear or I put it in my lip, I could have my lip lengthening, but that ring has to really stay there. If I put the ring in today, I try and pull it out and lengthen it, and I take the ring off, I'll just form a scar. It will just go back to itself. So there's an adaptive response that occurs, and the tissue will lay down more tissue. If it's impact, it will sort of change its form if there's a lengthening tension. So I think the terms that we used before are terms that because we didn't understand what's happening. Now we understand in soft matter physics, we understand in aesthetic behavior, even things like the Achilles. Everybody thinks that the Achilles is working, the best way to work the Achilles is to shorten it by doing leg raises and stuff. And we know aesthetically that doesn't work for material like that. So we have to understand the movement. For me is the most important thing, is that what is it the intentional, intelligent movement supposed to happen, and how are we going to address that based with the type of tissue we have, and how we're going to use those tissues to the advantage of what the dynamic movement, and it all has to be a dynamic process. So it's an interesting thing to look at.
Completely agreed, sir.
Just real quick, Wilbur. We have in our advanced courses, I teach a way to, for lack of a better term, to adjust or balance out the fascial net so that when you're testing the hamstrings, for instance, and it goes down to experience, Wilbur, you know this, when you lift a leg and you feel a difference in weight of one leg versus another leg, or other indications that it's somewhere else, it's in the capsule, it's not in the hamstring when you lift the leg. This comes with lots of experience. You just know something's not right. And then the next thing is differential diagnosis. Where is the problem? As you know. So we go through the layers by, if we just look at the fascial net as a net, literally, and start with the superficial fascia, I will take my hand and I will start testing where along the lines of the connecting points, let's say along the superficial back line, if you will, if you believe in that model, where I can adjust the tension so that I will lengthen it and see if there's a response, that there's a positive response. If the muscle is torn, I will shorten it. Then they get a positive response of no pain. If I lengthen it and it's torn, they get pain. So I use two hands, right? One hand is moving the limb, and you do this too, but I just have a different paradigm of looking at it, where I will scan the tissue, I will identify the area, I will constantly test to see where is the best response, and I will either lengthen the tissue during my test, shorten it, or stabilize it. And with those three ideas, A, B, C, shorten, I will shorten it, stretch it, or lengthen it, or stabilize it, I know fairly quickly as a diagnostic what to do for that tissue based on testing the layers of the tissue superficially down to deep and location, whether it's distal or proximal. I'm literally having this concept where in the fascial net, it could be anywhere, right? In the hamstring, it could be anywhere along the back, all the way up to your head. I will use my hand to gauge that and test it in functional position, standing, as well as on the table. But I don't know if that makes sense.
Well, yeah, I mean, that's true. I mean, because I mean, somebody could pretend, which most people do when they test hamstrings laying down, they think that the problem is the hamstring, but the hamstring is not really the problem. It could be, it could be in the hip, it could be thoracolumbar fascia, it could be the latissimus. I mean, it could be any one of these tissues. And I mean, again, we look at, says, you know, how important is lengthening? If you're looking at a runner, for example, how important is lengthening, you know, a hamstring to running capacity or ability? We know
It's usually the victim in the situation, huh?
Yeah, we know it's not that crucial. I mean, so I go back, I look at this thing totally different, coming to this biotensegrity principles, applying the principles in terms of what are we actually doing to tissue, and how are we deforming this soft matter, and what's going on with hyaluronic acid, and how hyaluronic acid changes its, which is it's in our system. It changes its consistency based on physiological thing of heat, of cold, of inflammation, where it gets sticky and stuff. And are we actually just moving fluid in different places, or getting the fluid to change its behavior? I mean, or are we actually changing connective tissue, especially in immediate results that we see with stuff? Because it takes time for tissues to adapt. The cellular behavior and the cellular mechanism, turnover of protein and stuff, takes time. So we actually are just shape changing and shifting the consistency and the physiological and the chemical behavior of the glycosaminoglycans, that gooey stuff that we talk about, that soft matter. And this is something that I think stretching, the physiology of stretching, have to start looking at. Are we just doing physical structure changes, or in terms of the fibers, or are we also changing some of the soft matter concept in terms of the holding elements of the gag and the
I'm going to interrupt. Sorry. We've got only a couple of minutes left, and thank you, Wilbur. Sorry about that.
Thank you, Wilbur.
Thank you, Wilbur.
100% agree.
We've only got, let's see, we've only got a couple minutes left. We want to do a closing toast. And before that, we're going to try to squeeze in 2 more questions. Rachel?
Our next question was from Kimmy, and I don't know if she's still here.
You can read it.
So her question, let me go to Connie, who had a question. She can ask her question, then I'll find Kimmy's question so I can read it. So Connie, we can unmute you and you'll be next. Okay, you should be good, Connie.
Hi, everyone. Thanks for this. Everyone can hear me?
Yes.
Okay. I was just wondering, can you talk about when you don't feel as much tone in an area, or where there's a lot of slack, how you experience that and how you might restore?
So are you talking about like deconditioned tissue?
I don't really know what I'm talking about. I'm not being specific. I'm just saying in general, when you feel an area that might be unconscious, because we seem to be talking about areas that have stickiness, and what happens when it's not sticky, but it's not active?
So one of the things that is kind of in the journey of discovering what's happening with their body is if something is underactive or maybe understimulated, it usually is a balance to something being overstimulated somewhere else in the body. So a lot of times if we'll focus on something that has like hypertonicity or more stickiness, if you will, we'll focus on that. And oftentimes that regulates and balances out something that's not getting as much tone or signal. Does that make sense, Chris? Does that make sense, Connie?
It does. I know I'm a movement artist myself.
Sure.
I also have my own somatic practice. I find that when folks try to work on their own, they often go to a place where they're so pooled, they don't have tone. Like so it's very difficult for them to get information.
Then they need to go somewhere else, right? I think where they're drawn naturally, unfortunately, is not always the best place to work from.
Right.
So I think sometimes going to another place, maybe the opposite of it, and trying to balance it out. Because I think, it goes back to like the dancers that are really, really good at stretching what they're already too limber at.
Right.
And need to go to the corners that need more attention to take the cobwebs out.
Right. Okay, thanks for that.
You betcha.
Hey, Rachel.
Okay, Kimmy says, thanks for your presentation, Chris and Anne. It seems that you are stretching in the extreme ranges of motion. Do you see your method being used by people who move in the quote unquote normal range of movement, or only by people who need those end ranges of motion?
Oh, that's a great question. The spectrum is from people that barely move to people that need to move to extreme degrees to make a living. So my background is working with professional athletes, and Chris is working more with the medical. So the technique itself can go from very, very little and very subtle and small, from people that can barely move to people that have demands of huge range. So the spectrum is the entire length of not being able to move and needing movement somewhere to start to the edges. So we design it to whatever it is. And one of the things that we continually do is downregulate and bring it smaller, 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 particularly with people today that are so uptight and so bound and so tense that until you get some breath and just a little teeny bit of movement, you can't restore anything. So I think the spectrum is enormous, from holding and rocking to taking them into big movements. There's that whole spectrum.
We see stretching into a barrier that might be, it has nothing to do with extreme range of motion. It has nothing to do with the end of your movement of the joint. If you are, let's just pick a generically very stiff, tight person from lack of movement, and their ability to move is very little, we find a barrier right there that we call that R1, the first barrier, whereas maybe their normal barrier should be here. That should be R1. So if we encounter this barrier right off the bat, we are very gentle at trying to release and extend or open or increase that barrier such that they have a more functional range of motion to use, not excessive, because they don't need it. They're not a dancer or martial artist. They just need to move better. So that person, we meet them where they are, literally, and work with the generic restriction of the entire body. There's a lot of people like that. They just need our first level of training. And so many people benefit just from that. And hopefully that gives you a visual that we don't just work with extreme ranges.
That's great. So once again, you're just restoring that tissue mobility, joint play, all of that stuff.
We also downregulate. It has to do with the nervous system. It's not even about stretching to lengthen tissue. Again, that's not the goals. If I encounter a barrier of resistance, I feel there is some stretch. And again, it's that word again, it's the S word, but we're trying to downregulate. If I actually stretch something to lengthen it, that kind of upregulates someone. It's not comfortable. It starts to hurt. That's the opposite. We can use fascial stretch therapy to downregulate someone, but we still can encounter barriers, but it doesn't hurt and it doesn't raise your blood pressure and your heart rate, and you don't get alarmist because you feel like your tissue is being attacked.
Yeah, I refer to it as romancing the neuromyofascia, not attacking it.
Nice, nice. And with that, I wish we had another hour. We don't. You guys are wonderful for taking the time to come on today and tell us about your book and your work. I'm wondering if you could maybe flash that book picture again.
Sure.
That's got the coupon code. And then maybe Graham, would you mind telling us about the sponsors again?
Sure. Well, thank you, Chris and Anne. This Biotensegrity Tea Party is an all-volunteer production of the Stephen M. Levin Biotensegrity Archive, and made possible through the generous support from our wonderful sponsors. Starting with Handspring Publishing in Edinburgh, Scotland, producers of highly accessible, easily applied research-based material for movement and manual therapy professionals. They offer a generous discount coupon to those on the Biotensegrity archive mailing list and to all our Zoom participants. We are also generously supported by Chris Clancy's educational organisation, Embodied Biotensegrity, in Vancouver, British Columbia. And for those of you looking to learn more about biotensegrity, Chris's programs are an excellent resource. The BiotensegriTea Party is also sponsored by Artifact Pro of Madrid, Spain, where you can find beautiful and wonderfully constructed tensegrity models, including those of the spine and pelvis. Artifact Pro offers a generous discount coupon to our viewers on the Biotensegrity archive mailing list, and we are grateful for that. And if you want to know more about these discounts by our sponsors, then do join the Biotensegrity archive mailing list, where you'll get a link to the discounts. And finally, we are very kindly supported by the British Fascia Symposium in the UK, which not only organises their biannual event, but also several other exciting programmes. So check them out as well. Thank you, Susan.
Thanks, Graham. And Chris, if you'll stop your screen share now, we'll put it over to Anne and Chris one more time for a closing toast.
I want to thank everybody for participating and expanding, not stretching, the possibilities and the concepts where to evolve this. It has been stimulating and delightful, and I'm really thrilled to make some new friends here and to see some familiar faces. I hope we have our paths cross soon, and I thank you for sharing your time. And our Margarita's off to you here in sunny Arizona. We wish you well, and we wish you to have a most delightful rest of the day, and hopefully marvelous adventure into our futures together as we intertwine our understandings.
Here, here. Cheers, everyone. Thank you.
Oh.
Cheers.
Thank you. Amazing. More enlightenment. Oof.
And really, guys, make sure you check out their website. We didn't even touch on the life stretch stuff that you've been doing, which is so wonderful. I want to make sure you got to say everything you wanted to say.
Well,
I should give you, if you're interested, I have a gift for everybody here.
Yeah.
It's just, let's see, PowerPoint.
All the way to the end.
I have to go to the end. Sorry, I have to buzz through this. But at the very end, I have our YouTube channel. I have free stretches for you guys. And
oh, wonderful.
Yeah, so there you go. So YouTube, it's Stretch to Win Institute. Just look it up. If you want to subscribe, you can. Go to the playlist, the Stretch Programs by Stretch to Win. And these are free programs for you, and feel free to share with loved ones and clients. I gave you the stretch for prolonged sitting. You tried that for a minute today, earlier in the program. This is a full 7 minute because I explain everything for those wondering what are we actually doing with this. So that's for you. And then we have Core 4 on the floor that I designed that for a key 4 movement program to get you mobile on the ground or in a bed. You can do it in a bed if you're elderly and you can't get on the ground. That's a 15-minute program. And finally, there's what we call Life Stretch. And it's a 1 hour full mobility, mobilizing yourself and stretching yourself. It's constant movement, no static stretching. It's a lot of fun. Go for it and share it with others. And if you go to our website, we do have a Life Stretch certification. If you're interested in learning how to instruct that program for other people online or live, you can go to our website and check it out.
And that is a very affordable certification. You guys are quite generous.
Well, actually, right there, we have a special discount, now that you mentioned it, Susan, for 2020. And that was pre-COVID, obviously, with having a lot of fun with our people. That's where it's going to be like this. Even normally, we have more than 6 feet distance from each other. But we will have less people, half the class as usual, and more distance. It's a huge space. We have a big wall where we project what we're doing. And lots of bathroom stalls. So there's plenty of room for people to create the social distancing. We follow all the COVID precautions. So hopefully you can make it this year because it's a special reduced price. Thank you, Susan.
All right. Thanks, everybody. And next week, I've got to tell you, it's going to be all about me. Next week, I'm going to present, and Graham and Chris are going to help me on my upcoming book from Handspring, Everything Moves, How Biotensegrity Informs Human Movement. So hope to see you all then. Thanks, everybody.
Thanks, guys.
Thank you. Have a good week.